Hi, I'm Dr. Ramona Guthrie, the Assistant Chair of the Occupational Therapy Program. Welcome to the Dual Degree Program Virtual Open House. The dual degree in occupational therapy is unique for several reasons. First, the program allows students to earn both a bachelor's in social and behavioral sciences and a master's in occupational therapy in less time than it would take in a traditional bachelor's and master's program. The dual degree program allows students to gain admissions into the occupational therapy program as undergraduate students. Students must maintain a cumulative and prerequisite GPA of 3.2 or better in order to maintain their position in the program. Students spend their first 3 years completing the university core requirements and prerequisites for the occupational therapy program, and in their fourth year as an undergraduate, they begin their first year in the graduate level occupational therapy program. 50 hours of observation under a licensed occupational therapist is also required as part of the admissions process. Students will typically ask if completing more than 50 hours will increase their chance of getting into the program. And the answer is no. It really is more important that you make the most of your observation experience. Students must successfully complete the following prerequisites: human anatomy and physiology, and that has to include a lab, English, statistics, sociology or cultural anthropology, introduction to psychology, abnormal psychology, developmental psychology. Please note that CLEP, AP, or IB credits are not accepted. The occupational therapy program is housed in the School of Health and Medical Sciences, or SHIMS, as we're called. We are one of 7 degree programs in SHIMS. So what is occupational therapy? Occupational therapy is a discipline that focuses on the therapeutic use of activities of daily life to promote function and independence and meaningful engagement in tasks that people with disabilities or people recovering from injuries either want to do, need to do, or are expected to do. We work with clients across the lifespan, and we work in a variety of settings, including schools, hospitals, outpatient clinics, community-based organizations, and even in clients' homes. While the occupational therapy program at Seton Hall is the oldest in the state of New Jersey, under the School of Health and Medical Sciences, we are on the cutting edge of education. SHIMS has an interprofessional education program that allows our students to collaborate with students from physical therapy, athletic training, physician assistant, and speech and language pathology to focus on patient-centered care. We also have over 200 clinical education partners that provide opportunities for field work for our students. Field work is essential to successful completion of the occupational therapy program. Students also participate in research with our faculty. In fact, some of the research that our students have done have been featured in local and national conferences. We have international relationships with institutions in the Philippines and Belgium. Our students have had an opportunity to travel to these places to collaborate with students in occupational therapy programs to experience healthcare delivery around the world. In keeping with our Catholic mission, we have embedded several opportunities into our curriculum for students to engage in community outreach. Some of those opportunities include participation in national backpack awareness. We coordinate health fairs that focus on health promotion, including falls prevention, mental health and wellness, healthy eating, stress management, just to name a few topics. We also have a program where we collaborate with elders in our communities to help them learn how to use their electronic devices more efficiently to stay connected to family and to be able to just engage in those activities that they find meaningful in their lives. So that's been very important and very meaningful to our members in the community. We also have a state-of-the-art simulation center. Our simulation center includes an operating room, patient exam rooms, and the opportunity for our students to participate in assessments and evaluations with standardized patients. Our new campus, the Interprofessional Health Science Campus. We recently moved from the South Orange campus to Nutley, New Jersey. The Interprofessional Health Science Campus allowed us to partner with Hackensack Medical to provide an academic setting that is second to none. We have technologically advanced learning studios where students have large monitors that allow them to share their information in small teams, but to also project that information out to the entire class. We have a fully equipped pediatrics lab and an activities of daily living lab where occupational therapy students begin to practice the skills that they will need to work in the healthcare industry. So we are very excited about the new campus. The IHS campus also has a modern theater-like auditorium, and again, just state-of-the-art learning spaces for our students. We are very proud of the opportunities that we offer the occupational therapy students in our program. Recently, the occupational therapy program and the speech and language pathology program was awarded a grant for over $1 million from the Department of Education. The purpose of the grant was is to train students from both programs to work with students with special needs. As part of their participation in this program, our students receive over $20,000 towards their tuition. And there is a 2-year commitment once they've completed the program to continue to work with students with special needs. But it is an exciting program. It is a competitive program, so students are required to apply. They must be interviewed and meet other requirements in order to qualify for the program. Now I'd like to give you a general overview of the occupational therapy curriculum. So the first year of the program begins with a foundation in understanding what occupational therapy is and what practice settings we work in. The first year also begins the professional formation thread where students learn about the professional skills, not just the practical skills, but the soft skills that are required in order to practice as an occupational therapist. In the first summer and continuing into the second year, students begin to learn about medical conditions that are typically treated by occupational therapists. They learn the art and science of assessments and interventions related to clients that we typically treat. And there's also a focus on entrepreneurship, leadership, health and wellness, as well as culturally responsive service delivery. The students are also being prepared to participate in both level 1 and level 2 fieldwork throughout the curriculum. And in the third and final year, students are participating in level 2 fieldwork. Level 2 fieldwork consists of two 12-week rotations where students are actually in occupational therapy clinics. They are working with clients. They are being supervised by occupational therapists in preparation to sit for the certification exam and work as competent entry-level therapists. We do also provide a preparation course for our students, and we have a very good pass rate. So students who successfully complete the academic piece or the didactic piece of the program and fieldwork have a very good chance of passing the certification exam. Thank you for attending the dual degree program in occupational therapy virtual house. If you have additional questions, please feel free to refer to our website and you can reach out to faculty. Our information is also located on the website. Again, thank you and have a good day.